Diabetes is a very common condition that many of my patients have, and around 30% of them will develop a skin issue at some point during their disease. So how do you spot diabetes? Well, in this video, I'm going to cover a lot of different conditions and show you photos so you'll know what to look out for if you have diabetes. 7 of the most common skin conditions. What is diabetes? Diabetes is a condition that affects many systems in the body, and one of the systems could be your skin. Diabetes is a condition when someone's blood sugar levels are becoming too high. There are 2 main types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is a condition when your immune system attacks your cells and therefore you do not produce enough insulin. Type 2 diabetes, however, usually happens at some point during your lifetime. Type 2 diabetes is when your body does not produce enough insulin or is not responsive enough to insulin. It's usually a condition that develops later on in life, whereas with type 1 diabetes, it's usually a condition that develops quite young. So just to explain, Tom, type 1 is when you don't have the cells that are producing insulin, and with type 2 diabetes, it's basically when your body is not reacting enough to insulin, or your blood sugar levels have been too high for too long and your body is not able to produce enough insulin because of that. Number 1, acanthosis nigricans. Acanthosis nigricans is patches of skins which are darker and thicker than usual. It kind of feels like velvety pieces of skin. It can happen anywhere in the body, but are most commonly noted in skin folds, like around your neck, your armpits. This condition can also be caused by other conditions such as Cushing's syndrome, obesity, so it's important to see a doctor if you notice these skin changes. Number 2, diabetic blisters. These blisters usually pop up on your hands or feet, but sometimes can be seen in other places. The blisters may look scary, but they don't usually hurt, and they can take up to 3 weeks to heal. Again, they could be related to other conditions, but could be a sign that your blood sugar levels are not well controlled. Number 3, granuloma annulari. These are tiny ring-like bumps, particularly around your ankles or hands. The exact cause of these bumps is unknown, but it's thought to be related to inflammation. The treatment for this usually involves creams or injections, but if your symptoms are mild or you don't have symptoms, you don't always need treatment for this. Number 4 is eruptive xanthomatosis. These are breakouts of pimply, waxy bumps in different places in your body. Most commonly, your hands, feet, arms, or legs. You're most likely to get this if you're a young male and you have type 1 diabetes. They may not look pretty, but most importantly, they are not contagious. It's important to control your blood sugar levels to prevent these from recurring. Number 5, bacterial or fungal infections. Generally, diabetics are more likely to pick up infections. High blood sugar levels can dry out your skin and lower your immune system, which puts you at risk of developing skin infections. The most common bacteria which is likely to give you infections is called Staphylococcus. If you're worried you have a skin infection and your skin is painful, red, hot, it's important to see a doctor in case you need treatment like antibiotics. Fungi love to hang out in places where there's a lot of moisture. So for example, your groin, your armpits, around your feet. So there's lots of different infections that could be related to the fungi. So athlete's foot is one that you might notice around your feet. You may also notice a fungal infection called ringworm on your skin. And on your tongue, you may notice a fungal infection called Candida albicans. You might notice that you develop folliculitis, which is inflammation of your hair follicles, or you may develop fungal nail infections. If you're developing a lot of infections, bacterial or fungal, your doctor may need to check your diabetic control and check your sugar levels are what they should be to help boost your immunity. Number 6 is xanthal asthma. This is when you develop extra cholesterol around your eyes. You may notice flat or slightly raised yellow growths around your eyes, but they could signify raised cholesterol. These bumps are not normally painful, but they could signal uncontrolled diabetes or raised cholesterol. Usually high cholesterol and diabetes go hand in hand with each other. Number 7, foot ulcers. This can be around 34% of people with diabetes at some point in their lifetime. Risk factors for developing a foot ulcer can be type 2 diabetes. So generally, people with type 2 diabetes have more foot ulcers than type 1 diabetics, having poorly controlled diabetes or having had a diabetic ulcer already. The most important thing to be aware of is to notice the early signs of a diabetic foot ulcer. So this may start as a small scrape on the sole of your foot. Then that small scrape or small cut may continue to rub and develop into an ulcer. Foot ulcers are problematic in diabetics because generally people have poorer circulation, so reduced blood flow in that region, as well as damaged nerves, which make it more difficult to feel something when you develop a cut. So if you have a small injury or a small cut, it's much more likely to become an ulcer than for someone who doesn't have diabetes. The most important thing is to notice the early signs of an injury and take the appropriate care, so basically checking your feet regularly, and when you do have an injury, make sure it heals as quickly as possible. So avoid walking barefoot, make sure you wear the right shoes, make sure you regularly examine your feet. These are all the right steps to preventing ulcers. So if you've got diabetes, how does it really affect your skin? Diabetes can affect your skin by causing poor circulation, which means reduced blood flow in certain areas. This means your skin has a reduced abilities to heal itself from infections or inflammation and can lead to other skin conditions developing. Commonly asked question: what are the first signs of diabetic skin problems? Early signs of diabetes skin problems can include very dry skin, itchy skin, or yellow, brown, red patches on your skin. How to treat diabetic skin conditions. As we've gone through this video, I've explained that diabetes can lead to different skin conditions. So the treatment will depend on which skin condition you have, but the most common ways of treatment include looking after your sugar levels, managing any infections you have, and keeping your skin barrier as healthy as possible with regular moisturizing. Thank you for watching today's video, and if you can click the subscribe button, it really helps my channel to keep growing. And if you can write down any comments below, it again helps my channel to keep growing. And thank you for watching.